wide range of community leaders, which include paramount chiefs, religious leaders, community organizations, health officials, mayors, youth groups. And the idea here is really being able to provide a platform to spark dialogue and planning on how to effectively tackle malaria using the community's resources, networks, and influence. We've heard over and over, and we all know how important it is to have tailored strategies for each community. And so it is critical to be able to include the communities within the process. We will, of course, be hearing over the next hour about best practices for effective community engagement and activism in the fight against malaria. So without further ado, I would very much like to introduce our fantastic speakers for this session. And I'll start with Vicky Okine, who's the Executive Director of Alliance for Reproductive Health and Rights, a network of Ghanaian civil society organizations working to realize the health rights of underserved communities and vulnerable populations. The second speaker is Dr. Koku, who's the former director of Ghana Health Services. He is a public health physician and health systems and policy analyst. Dr. Koku has over 3 decades of experience in senior health management in Ghana, including 16 years as district medical officer and medical superintendent. The third speaker is Estina Taylor, who's a project coordinator reporter on our radar. Estina has over 10 years experience in the media and media development world, and she's incredibly passionate, as you'll hear later on, advocate of community voices and the expertise that comes from lived experience. And finally, our fourth speaker is Lilies Nyanga, Africa Director at Malaria No More UK. Lilies has over 20 years of experience in development, banking, and ICT sectors, 16 of which have been specifically in international development organizations with a focus in the health and education sectors. So we very much look forward to engaging with our speakers. But before we open it up to questions, we are going to watch a short film from On Our Radar that highlights some of the challenges that remote communities face, and we'll hear directly from women who are advocating in malaria in some of the more left behind areas.
The head with the turn back, and the heart with the little self. Not the thing right.
I'm not a man, sir. We come, and you worry me. Look one looking condition, you be pale, and get high fever. So that's worry me. For me, I go come to an aid. I do RDT, be positive, just as I was saying. But I never forget all the essential drugs. For me, I go come to in care. So what I do, I refer an Abont government hospital. Maybe anemic. And as a woman, we all know what that means because you're going to labor. So then I keep hold on my yarn, you're going to labor, you not get better blood. If I make a referral. So now we say if na boat be there now so as standby boat for the PHU at any time, any emergency or any need arise for any referral case, it will be simple for me.
Na part the boat no use for because fear not be there. You not get my issue because when you miss them, you attack you work with swim. 1 hour 20 minutes now they take for go boat by the boat. What have they done? Not they done. And the wall, the green, I go boat and then I be pray God for my country, my country and my family. I miss the job they have they eat because the job have they eat and not they eat another day. That's what I feel bad. For my country. I miss me, but I miss my family there. In the nurse then advised me say, I go to eat fine chop, big fish there, so now they can cook and eat them.
The situation for Maria and I is not really good. because as you see the community na riverine area, so they get most of malaria cases then are where they affect both pikin them and big people them. The staff really boring. We now 4 in number. But look at the community. Me go come now so I'm for beer. Then because of I like my job. But the other person go come and not be able. Go for live now and not easy. And mosquito when I'm going away to bet you na they do na wetin malaria. And malaria not good for mortar man, especially the woman there. This na my colleague nurse na young quarter this. All side well. Look the domot na ya. The domot all long well, but Bob not eat am. At any time, if man will break this domot, can sell am for active na ya. So the staff business, when government puts attention, who they na their remote place there, at least that remote allowance. Make it go dey calm. So we encourage you. If not, then I ask where you not be on salary. How we expect them for make it work successful one. We need great attention here. So at least there are 3 things they are so don't name so. The boats for referral cases, then the staff, at least make we get staff then I also according to the criteria CHP forget 12 staffs then I. But now almost then now 2 green then. Then 3, in terms of drug facility. They will forget drugs, especially the essential drugs that make it go day for the people.
What a powerful video. This is really a reflection of how important it is to really be able to hear directly from the communities and really be able to hear from their voices what their experiences and what their needs are. And looking forward to hearing more from Estina a little later on specific to this. But wanted to now turn it over to Koku to introduce the next video that we will be showing on the malaria community scorecard in Ghana. Koku, over to you. And if you could turn on your video, that would be great, if possible.
Thank you very much, and good morning and good afternoon. Yeah, so basically, we want to also show a small clip video on community scorecard. I think that in the first 2 sessions, mention have been made of community scorecard. It is an accountability tool, and it's very participatory for community members to be able to, engage themselves in as part of the health system, to be able to discuss and make choices or decisions that affect the health service delivery in the community. So let me turn it over for the video to be shown, and then later on I can make more comments on that. Thank you very much.
Thanks to the community scorecard system, a septic tank is being constructed for an existing washroom near the CHIPS facility.
I'm John Kamasa from Avema. I am the organizer. Le miape takpekpe ke mie wo alo workshop ke mie wo le batoa. Mie de jesi kuhui wame eton a sheki le takpekpa me. Be wa wi nye nu ke le fudan la miape Avema chip compound. Yet e ke ne mi gbodi mio health committee o mi gbogbo no anyi ye mi ba de jesi you nye vivito am eton. Wa we nye a septic tank, le poly tank, le vaccine fridge. Ike mia azan le te pa wa de mia jigba. Ya ta mi cho wa me eton wo be mia je wo do wo gom. le miaƒe workshop amedi ya miede dzesi le ƒã be ɖi ba mienya be ale nenema nua le o ya ta le workshop la ya mi health ami yo le training adi ya mi de dzesi ya ta le dzesi dede me eyi ke ne mia committee mi gbogbo va nɔ anyi vɔ ɖi ya mi va kpe be no ele be na amewo va ɖi ŋugbɔna afɔdzi dege ne ame va dzi vi ɖi.
So that was a very short clip on a clip from the community scorecard. Basically, this is a participatory and action tool that is used to leverage community engagement at the community level so that we can use that to strengthen the health system, a tool that is used mainly for accountability, but also to improve the quality of the services. You must be aware that health systems or health delivery services has always been very passive from the supply side. And our primary healthcare system in Ghana, for instance, was looking at how do we engage communities to be part of the service delivery, to make decisions that affect the service that they receive, to give feedback to the service so that we can use that to improve the quality of the services, to mobilize resources and make them part of the services. How do we engage communities, to have the buy-in to be part of the service? And for us, the community scorecard came in very handy because it's a tool that we have been looking for. And I think that even talking about malaria or other public health services, it is very important that we always make a very, very determined effort how to get communities involved, how to have their buy-in, whether we are doing malaria. This morning we talked about COVID, vaccination is coming in. There are a lot of misconception, there are a lot of apprehension. How do we engage communities using the structures in the communities to be able to get them to be part of the service? And so that is what the community scorecard has, we have introduced since 2018 with support from ALMA. It has become a very integral part of our health system, at least most importantly at the primary healthcare level, where we are using that to address the health system gaps, but also for the communities to use as a tool to mobilize resources, engage in local government, and be part of the health service delivery. I mean, we have, for the case of malaria, for instance, the communities through the Community Health Management Committee will meet and have a lot of discussion. Through those discussions, they will come out with problems. If I give an example of malaria, for instance, one of the major problems was that women were not coming to antenatal services. Women were not receiving their mosquito nets. They were not getting the IPTP, for instance. Why was there low uptake of ANC services in the community? And through this process of using the community scorecard to engage, to understand those reasons why they are not able to come to the facilities, they came out with their own solutions. They came out with proposals, including education of the community so that they can understand the benefits of ANC services. And, we're so happy to see a huge increase in the uptake of services. ANC increased over 90%, supervised delivery increase in the communities. And then there was less complications of deliveries and maternal mortality and newborn deaths. And so for us in Ghana, this group have come at a better time. We are scaling up, and the plan is that within a short time, the whole country will start, and all the facilities using the communities will start, using the community scorecard as a major tool, not only for accountability, but also for buy-in and making sure that, gaps in the health system are solved, not only from the supply side, but also from the demand side. Thank you very much. Over to you, Vasi.
Thank you, Koku, and really congratulations on your leadership and really the implementation of this community scorecard and really the results that you've seen as a result of it, and the commitment also to supporting communities in ensuring that their voices are heard and that they're part of the process. So for everybody, the full documentary is available to watch on the Alma Scorecard Hub, www.scorecardhub.org, and you can also see it in the chat. Also, please be reminded to submit your questions using the Q&A function, which is at the bottom of your Zoom screen. So please share questions with us through that function, and we will make sure to address them. In the meanwhile, I will ask another question that has been posed around. So the question is, pregnant women are some of the most vulnerable to malaria. What can be done to empower them to access healthcare and ensure gender-sensitive malaria interventions are prioritized? And I will turn it over to you, Vicky, to start. And if you can put your video on when you speak, that would be great. Thank you.
Thank you. Yes, empowering pregnant women is rooted in community engagement. You know, their participation in the various community engagement strategies that at least we have employed under the Bridging Gaps Innovate for Malaria program. Pregnant women are provided with information on their rights and entitlements, as well as responsibilities. You know, we try to instill a sense of rights in them. And then also the other side of it is the scorecards assessments. You know, in one of the assessments that we did with a health facility, we realized that the facility had run out of SP. This sulfur, it's a long name, quite a mouthful. You know, the facility had run out of it. So we engaged the leadership of the local level health facility to ensure that SP was available. And SP is for managing pregnancies. You know, it's a drug that is administered to all pregnant women during the first 3 trimesters, you know. So it's very important that all pregnant women get it. Then the other side of empowering pregnant women is decision-making through the scorecards assessments. So feel empowered with knowledge of their roles and responsibilities, and then on the other hand, getting the services available to them where they live, like ITNs and everything, and also involving them in decision-making, utilizing community systems and whatnot. It's a good strategy of addressing gender in community engagement. Thank you.
Thank you very much. Yes, you mentioned 2 very critical elements, ensuring that they have the services that they need and that they're involved in decision-making spaces. Absolutely. Estina, maybe I'll turn it over to you now to see if there's anything you would like to add specific to this question.
Yes, one more thing I would add from what Vicky has said would be positive role male role model. So what I mean by that is sometimes these women, they're tired of going to the hospital, or they don't have the encouragement. When you're pregnant, you're tired sometimes, you are demotivated because of distance. There are lots of issues, but we in communities, we have been preaching about positive male role models. So we have been encouraging men to at least take their wives to the clinic. It's something that is hard to do. But if community can encourage, you know, men, or if the community leaders in their communities can encourage men to take their wives to the clinic, you would see that with what Vicky has said, meaning taking them to the clinic or taking drugs and other essential things to them if they can't access the clinic. These will also be another option to help them. And in fact, even taking the drugs, sometimes some women, when you're pregnant, you're tired of taking medicine and all of these other things. But if you have a man, your partner or husband, who would encourage you, it will help you to take the medicine and, you know, go to the clinics.
Thank you. You make a very good point there. It's very important to associate,
Just Martin, just to make a point quickly to build on what Estina said, the role of men involvement in health service delivery. Again, that is something that should be emphasized at the community level, the buy-in and engagement of the community, where you have to get men involved. That needs a determined effort, okay, because of our cultural preferences, the way that we do things. Through the community scorecard, those are some of the issues that comes out, how men are not supporting the women in the delivery or assessing services. And I cite with her very well that, yes, there are tools like community scorecard can be used to engage men in communities to be able to be involved as active participants of health service delivery within the family. Thank you.
Thank you for that, Koku. Lilies, do you want to add to this discussion?
Yes, thank you very much. I think just to add on to what my colleagues have mentioned, looking at the whole dimension of the involvement of men, and I just want to add the aspect of involvement of traditional and religious leaders in this aspect. I think it's very important. It's all just helps and complements what was being said, and looking at the untapped resource that is within the community, and that would actually push that forward. Again, I would also want to just bring in the youth in that. A lot of times we probably don't think of them as much, but they are sort of an eye in the community. They get to see what is happening, and they are a key resource that I believe we can use, that we can make use of, and can complement all that my colleagues have said. And I mean, if we look at our continent today, I think that's our largest resource within the community. We are 74% under 35 in the African continent. So what a better resource within the community that we can make use of to support everything that that is being implemented towards that. Thank you.
Thank you very much. We have another question which has been posed from Muntaga Dia, which is, how can we include community engagement and community scorecard training in curriculums, working with universities and partners to really ensure that this is an integral part of the training of community health workers? So we'll start with you.
Maybe I can try. That's a very good question, and it's something that we have been thinking about and we've thought about severally. Because to be honest with you, we have spent a lot of resources on post-service. People go to school, they learn a lot of things. They come back to start work, and then we start doing a lot of in-service training. So pre-service training is very important. Ways that we must begin. So we are doing community scorecard, but these are all, people will go to the facility, they go to the district, and we train them, and then they absorb that. But yet people are in the school that are not coming out with these skills. I think we need to start looking at developing a curriculum, engaging with our training institutions that, they should be engaged so that they can do a pre-service training for some of these tools. It's a very important way. But and also making sure that if those, the practicum or the practicals of the students who come every time, by training, they go on the field to do some work, those that they are introduced to some of these tools before they actually graduate. But I accept that, pre-service will be a very important way, because even for Ghana, the scale and the rollout is slow because, there are a lot of resource implications, time, money, all that. And I think that when we do pre-service, that will help a lot. Yeah.
Thank you, Koku. And maybe before I ask others to react to that question, there is another question from Alexandra Gordon asking, what is your advice for organizations that are interested in starting to implement the community scorecard? And what have been some of the biggest lessons learned so far in implementing them?
This is a very, very familiar question, very important question. Even within our own system where you have a community that when you introduce a scorecard, you have other, and they are seeing the benefits of the enthusiasm of these communities, the improvement in their health, the outcomes are better. Other communities come and say, look, what are you doing that you are not getting maternal mortality, for instance? What are you doing that malaria incidence, your communities are low or children are not dying from malaria? So they are also asking for community scorecard. Well, we had, like I said, 2018, we had a first support from ALMA, and I think ALMA is still available and ready to support countries. One of the things that we have done, and that has been beneficial for us, is to be able to understand what exactly is this tool and how it's implemented. And so we have also tried to use study tours to, peer exchanges to be able to understand, learn and then go back to implement. You are not going to start community scorecard all over, totally, completely, all of a sudden. You're going to start small, begin small, think big, and then move along. So I think that, and of course, there's an ALMA website also where you can go and see what is needed. And, we can share ideas as to how we can support each other, each country to be, but there are tools, there are guidelines, there are, guidelines that have been developed to be able to, implement scorecard. And we can keep that discussion going and see how we can support each other.
Thank you very much. Vicky, I will now turn it over to you to see if there's anything you would like to add with respect to how communities can implement scorecards and maybe share some of the lessons learned in your experience.
Thank you. The first thing I'd like to emphasize is stakeholders, engaging various levels of stakeholders, engaging community members as part of the scorecard process, engaging service providers, and engaging leadership within the community. I mean, every community has its own structures and its set of leadership. And one of the big benefits we have had from the scorecards is how the scorecards becomes, or the process becomes a preventive measure in itself. The more communities participate in the process, the more they understand what the obligations service providers have to communities, and then they also understand their roles and responsibilities, and more importantly, bringing them all together to assess or to share the results of the scorecards assessments enables communities and providers to work out solutions, based on the gaps identified from the process. So bringing all the various parties together is really key. In some of our community scorecards assessments, the gaps that were identified, for example, chairs or seats in the waiting areas, which made it very uncomfortable for people to go to the facilities, and then also water, sanitary facilities and whatnot, were all unearthed as a result of the scorecards assessments. And because they had participated, because they were getting first-hand information, and because their chiefs or their community leaders were present, they all came together to procure these items. They bought chairs for the health facility. Waiting, therefore, became less of a problem because many people stay away from facilities due to discomforts and whatnot and hygienic conditions, interestingly. So the sanitary issues were all addressed as a result of the gaps identified from the scorecard. So back to the question, or back to the issue, stakeholder engagement is a very important part of the process, and then involving community members when results are being disseminated and making sure there's adequate representation of the various levels within the community in the process. Thank you.
Thank you very much. I think you mentioned very key and critical elements, which are the need to have stakeholder engagement, but even more importantly, to have community leadership and really ensure that the mechanisms are in place to serve as a way to bring together stakeholders, identify gaps, and then provide solutions. I have another question here that I would like to pose to you, Estina. What lessons can you share with us from the recent Ebola outbreaks in Africa as public health decision makers consider how best to engage communities on malaria through the COVID-19 pandemic?
Well, during Ebola, what happened was, you know, so many people, it was new to them, to their communities, and they were losing family members and all. But like the messages were different. Everybody was giving different messages because nobody understand what really Ebola is and how dangerous it is and how to prevent it. So there were lots of messages, but what helped was, you know, partners in health coming together and also preaching one message is using the media, that was one. But through the community, it was using people from the community to pass on these messages. So in different places, there were lots of people like who could not believe if you tell me that this is what I should do. I'm like, where are you coming from? So we had to use people, police officers who are older police officers, they are working in Freetown, Sierra Leone. We had to use them as community champion to talk about these things, to go to their communities and say, I am from this place, I hail from this place, and I know you guys can trust me. So I am saying this, these and these and these are the things that we're supposed to do. But also it was because they included the communities. You know, they ask them, what and what are we supposed to do? If we are supposed to build a testing place, where exactly do you think we can build it? And how can we encourage people to practice behavior change communication? It was really important. And it was one of the things that helped Sierra Leone to succeed in coming to an end or bringing Ebola to an end. And I'm sure even COVID, that is the situation. So you cannot tell people what to do, because sometimes they don't believe you. But if you use champions in their communities, use people who know how to talk about these issues in their communities, they would listen, they would adhere. But importantly, what Honorata does is to involve people who already have the experience, lived experience. So we don't take people from other places. They live in the communities, we use them to advocate, we use them to report on their issues, because they're the only ones who can better report on these issues.
Thank you. You are absolutely right. There's no one better than community champions and leaders to ensure that the messages are understood and listened to by our communities. I will now turn over to you, Lilies, and really understand from your perspective, how do community-based approaches to malaria reduction and health system strengthening differ from and complement between the public and informal sectors, and what can be learned from this?
Thank you so much for that. I think one of the things that we can learn from the community health, the whole infrastructure, is that is not one element. It's a multiple set of elements that all need to link to one another, and also that getting communities. I love what my Estina has mentioned about getting champions who can be able better to communicate. I think also understanding how the whole infrastructure works and how it is all interlinked is very, very important. And I want to take the case of malaria and how really weighs heavily on the whole health system, and how being able to have a complementing attitude and being able to see how addressing these, and communities being able to see how addressing malaria will be able to free up the health system to enable the community to really benefit from the health system and be able to actually leap from the benefits of having a health system that has been freed and being able to engage not just the community, but also seeing how the public, how the private can also link into that is really, I would call it, is a whole all-round kind of engagement. Yeah, thank you.
Yes, and just to make a quick, thank you very much, Lily, for that point. Just to make a quick addition to the earlier question that is asked on the malaria scorecard. I mean, I talked about community scorecard. As we see new diseases, whether it's Ebola, whether it's COVID, and it came up this morning session. How do you use communities to address issues now of COVID, the misconception? We are now getting vaccines in. There was a study that shows that out of 200 people interviewed, almost 140 say they are not going to take the vaccine because they are afraid. Okay, we have community structures. So the same way that we have developed community scorecard, we have malaria scorecard. It's a tool for mobilizing community, engaging them, and being part of the process in addressing those diseases. It is the same that we have TB scorecard, RMNCH scorecard, So it's a tool that can be adapted in a way that once you have emerging issues in the community, you can apply the same principles, target at those interventions, and see how you get community buy-in and get a community engagement. So we have community scorecard, we have TB scorecard, we have HIV scorecard, we have RMNCH scorecard. Soon we'll have Ebola scorecard, we'll have COVID scorecard. And the process will be that how do we now integrate all this in the community so that we have, that's the process that we should be thinking around. But definitely the same principles can be applied, in engaging communities, particularly for COVID now, when the action seems to be more in the urban areas than in the rural areas where the majority of the people are living, and yet we don't see that kind of engagement going on in terms of what they need to know and what they don't need to do. Thank you.
Koku, before I ask our other speakers if they want to add anything, there was a question specific to the scorecard in Ghana, and the question is from Prince Imoro Awimba, and the question is as follows: is the scorecard been scaled up for all health managers, district directors of health, malaria focal person as a monitoring tool in Ghana?
Absolutely, as a monitoring tool at Ghana. We have reports that we generate every time based on the activities. The communities they will have a predetermined indicators. For the community scorecard, for instance, we develop 9 indicators that are monitored and reported on, and that is fed into our national, health system database, the DIMS, and then it's analyzed, the feedback is sent back to the community. So that is how it works, and definitely it's a tool that can be used, across board to make decisions around. Yeah.
Thank you. And just to add that the malaria scorecard for Ghana is also available on the scorecardhub.org.
Yeah.
Thank you. So I don't know if anybody else has anything else you would like to respond to some of these questions before we go through a final round of questions from me.
Well, apart from the scorecard, it's something that I'm really interested in, and it's something I think we can adapt and use in Sierra Leone. We can add to what we are doing or what we're using. So basically what we do in Sierra Leone is called the community solution-driven accountability. So it means that if you go into a particular community they have to own the process first. So you can't take drugs or you can't take things to them without letting or without them knowing or without involving them in this process. So on a radar, what we do is involve these community reporters. They know about the processes, but also they are mostly involved in all of these things. And we work with TBAs, the traditional birth attendants. So people who traditionally delivers women, they have been called as one of the people who cause problems that deliver women behind the nurse's back. So now they're using them to be as a mediator. So they are the ones who check these women and take them to the clinic. And also they are the ones who hold to account the health workers. We have also what we call the Village Development Committee and Facility Management Committees. These are all committees who play a mediation role between the health workers and the people. You know, in my country, we have a problem of not talking about things bothering us. So with all of these committees in the communities, if I have a problem with the health center, maybe I'm being molested in the center, I will go to them and they will be like the person who will talk for me and advocate for me. So these are all of the things that we are doing. And we as Honorada, we work with all of these communities to make sure that these established bodies, they are able to help the community achieve like accountability, hold their leaders to accountability, but not only their leaders, they are also holding themselves to account. So what we've been doing, when we go to communities, we've been asking them to make commitment. So they will say, oh, it's with the health workers because they bring in the drugs. But what about you who stay home and sometimes you don't go to the hospital to access the clinic? So we are asking them to make commitment that if my child is sick, I will take them to the hospital. That is my commitment. And moving down the line, what we are doing is we're going back to these communities. And when we go to these communities, we're going to ask them how have they been keeping their commitment, both the health workers, community stakeholders, community people, all of them, they are included. Everybody have the opportunity to hold themselves accountable. The health workers to the people to the health workers. So that's another thing.
Well, thank you for that. And maybe just, we saw that great video earlier on, you know, can you maybe share an example with us of accountability following the films the reporters have produced and really being able to make that link to what you just described now?
So that film, when we went to the community to do the screening, you know, we had the DMO, we had people from all the health partners and everything, the DHMT, the district medical team. Then we played the film, and then they were like, oh, well, we have treated or we have addressed that issue 2 years ago. And then somebody said, no, this issue is still here. There is no boat to take people who are sick to Bonth Island. And to ride on top of a bike or to walk is one thing. But imagine if you are on an island and all you have to do is take a boat to go to the island and you don't have the money to pay for a speedboat. So that's the scenario there. And that in that particular event, we saw people holding their leaders to account, telling them that no, there has been no boats. And this is something that has been a problem in this community. And if that can be solved, then I think things can go the right way. That means if people have emergency, if we have to refer, we'll be able to refer them. So they held leaders accountable for not providing a speedboat that can take them to the next island for better health care.
Thank you, Estina, for providing that additional information. And you know, it was really great to see the community engagement and how you can use some of these tools to further hold our governments accountable. I see that there's quite a few other questions. So what I propose to do is maybe to ask them, you know, to ask them to pause all three of them, and then I will hand it over to each one of you to see if there's one of these that you want to answer specifically, but also share with us some of your recommendations in terms of lessons learned. So the first question I see here is, what are the biggest fears with getting the vaccine, and how are myths being dispelled within the community? The second one is, have community members ever had scorecard fatigue as a result of overriding priorities? And the third one is, what is the experience of community scorecard exercise in urban areas in terms of attendance and participation? So those were some of the questions that were posed from our participants. And the recommendation specifically that I would like you to share with us is really, as we look at learnings, or, based on your experience, what can you share with us that we can consider as we're developing this type of community engagement work? So Vicky, I'll start with you.
I'll start with recommendations. Community engagement is a very useful process in working in the health sector, especially at the community level. There are several, it has several uses, or, it's useful in various respects. First of all, successful preventive health interventions are greatly dependent on participation. Communities participating in the various interventions and eliciting their support is also very important. It's key. It's important for health, preventive health, to be rooted in the context of a community in which people live, because we are ultimately trying to influence their behaviors. We are trying to influence the determinants of their health. So, getting them on board is really important. And I think health has moved away, from a disease focus to a people-centered approach. So nothing better than community engagement to bring people on board. And then some of the community engagement strategies are really designed to empower community members, empower them to utilize the services, that there are, or services that they need, and then also giving them an opportunity to bring in their perspective. And then it also elicits their agency. And all of these work together to ensure improved health outcomes. I think we've learned a lot. Many lessons have been learned in this regard. And these are some of the lessons. And again, Bridging Gaps for Malaria also tried to focus or try to get communities to recognize the fact that in addition to government commitments, in addition to instilling a sense of demand, they also have responsibilities, and we oftentimes, in our zeal and passion to bring out community voices, we forget to remind them about their responsibilities as well. And then partnership with various stakeholders not present in the communities, like universities, for example. We've worked very closely with the School of Public Health. They've brought in their expertise in data management, data collection and management, and actually using the data to working with us to have the data used in improving decision-making at the community level, and decision-making basically. So I see you nodding. I'm probably using up too much time, so I'll just wind up. Yeah, so engaging stakeholders outside the community, outside the civil society space, and bringing more people on board, and advocacy is really dependent on evidence, and that's what we get. We get quality evidence from we get quality, or our evidence is improved by engaging the universities. And then last but not the least, the private sector. Our project is being implemented in an area with a lot of private sector companies, oil companies, oil palm companies, you know, big companies. And we have tried to work with them to engage them towards sustainability of the interventions, you know, because we will be pulling out. And when we do, we must be able to leave some means through which the community issues can continue to be addressed. And well, I think I'll end it here. Thank you.
Thank you so much. That was hugely helpful, appreciative, and certainly shows the big level of commitment that you have. Now we only have 5 minutes left, and I really would like to have 3 minutes for the video at the end. So Koku and Estina, I will ask you if you can give us in 1 minute your key recommendation following, you know, your learnings and your experience, and based on some of the questions and the conversation we've had during this session today.
Yes, so thank you so much, Wasi. Sorry about the time. Just to answer one of the 3 questions that was posed, that is there been community fatigue? No. When the benefits outweighs, you know, the community getting fatigued, and we are inundated with a lot of fertility community that come and say they want the scorecard. But my takeaway message is the importance of community ownership and buy-in when it comes to, you know, our interventions in communities must not be lost to us, whether it's malaria and other public health interventions. The importance of community engagement and community buy-in to our programs, you know, must not be lost on us. Thank you.
Well, for me, I would say sensitization. But while doing the sensitization, it's very important we have to use people who live in that place, who have the experience, lived experience to do sensitization. And ways that we can do is using music, local community music, people who sings, they can translate messages that people will understand, and using drama also. They can play these dramas and they can listen and have a discussion. So the important part of that is having the discussion at the background of all the drama, the music. So these are things that we can use to, you know, sensitize the community about malaria, COVID, Ebola. It's very important that we use the community people, we use their experiences and their resources like music and drama. Thank you.
Thank you. Indeed, it is critical to involve our artists and local influencers and really ensure that we're bringing in culture. And this is a great segue into the final video of the evening or day, depending on where you are in the world. And so it is with great pleasure that I will hand it over to Lilies to present a new wonderful campaign that was just launched today. Lilies,
thank you very much, Dean, and thank you very much, everybody. And indeed, it's been a great moment as we look at the community engagement and how we do that. And we just want to bring the part of the community, the youth as being part of the community, and how the youth can continue to engage in this. And Draw the Line Against Malaria campaign is a new youth chapter of the Zero Malaria Starts With Me movement that calls on young people across Africa to unite to fight malaria by driving more action, more innovation, more funding, and more leadership to end this disease. The initial campaign focus will be on driving a global awareness of malaria ahead of the Kigali Malaria and NTD Summit at the Commonwealth Heads of State meeting in June. And that will not stop there. We hope that the momentum will be sustained in the next 3 to 5 years to ensure that there is awareness, there is visibility around the world to ensure that we are on track to end malaria. And we hope that this campaign will continuously engage in country to ensure that there is context and alignment within the African countries, and that it will engage key part of this campaign. Key people within this campaign, the heads of state, business leaders, brands, celebrities. We've heard of champions being mentioned. We want to ensure that they're continuously engaged, and influencers. And this campaign has engaged various celebrities and influencers across Africa, and we are hoping that this momentum will be maintained and we'll have more champions and influencers engaged. And essentially, Drop the Line is a unifying power of art and entertainment, and it's great that this has been mentioned, that will inspire young people across Africa and around the globe to get into action to ensure that we are on the road towards zero malaria. And at the heart of this campaign is a fresh, new, universal visual language that is made up of lines, symbols, and patterns that really are a representation of the solidarity and the actions that are needed by all of us to ensure that malaria can be ended in a generation, and also calling for innovation, calling for bold action against malaria. So each line will create a unique piece of art that is added to the mural. And this piece of art will be represented to the world leaders during the Malaria and NTD Summit. And it's really a representation, as I've said, of the solidarity. And we hope that within the summit, we will get to some milestones that will be a game changer in political decisions that will draw us closer to having malaria by 2023 and cutting malaria down by 90% in 2030. And as I hand over to the host to play the film, I just want to call on all of us here today to draw the line against malaria. Please visit zeromalaria.org to draw the line. Commit to join the March of Solidarity. Take action to end so that we can all end malaria within a generation. And I'm sure together we can do it. And I want to thank all the partners that have been engaged in development of this campaign and are continuing to be engaged. So thank you very much. And I want to hand over so that we can play the film. Thank you very much.
Malaria, we won't let you steal from us anymore. We are the generation that can end malaria.
Malaria, we are too strong for you.
We're too bold for you.
Malaria, we are too fast for you.
Malaria, I don't like you. Too fierce. Too smart for you. Malaria, don't even dare take our future with you. Malaria, you can't stop us. Nothing will keep these lines from growing. We are the generation that can end malaria. It's time to take our future back.
Wow, what an incredible video. I think this is the best way of ending the session today. I mean, it was bold, inspiring, creative, and really, I think it's inspired all of us to take even more action and really commit to supporting the movement more broadly, but also specifically on this new campaign that launched today. So let's all draw the line against malaria. This brings us to a close for this session, but also to the series of events or sessions that took place today, fighting malaria, improving health across Africa, that was brought to us by the African Leaders Malaria Alliance, Comic Relief and GSK. Thank you so much for this wonderful event. It was very insightful, a lot of interesting, powerful conversations, and certainly we've seen from our speakers today, particularly on this session around community engagement, how they've been able to share some of the lessons they've learned from their experience working in communities. So I would like to take this moment to thank everybody for your engagement, your participation, and it was truly an honor for me to be moderating this session today, and I wish you all a great end of the day. Thank you very much. Bye-bye.